Good morning. Thank you all for being here. This is the 8th year of the Healthcare Fraud Takedown. This event highlights the enormity of the healthcare fraud problems we face. This problem is compounded by the fact that our country is in the midst of the deadliest drug crisis in our nation's history, causing more deaths than we've ever seen in our nation. Indeed, an extraordinary number of the cases that we will be highlighting today that are in our report involve opioid prescription abuse. One American dies of a drug overdose every 11 minutes, and more than 2 million Americans are ensnared in addiction to prescription painkillers. Every day, as a result of drug abuse, American families are being bankrupted, broken apart, friendships ended, and promising lives and careers cut short. Drug addiction is causing more and more crime and violence in our communities across this nation. Too many trusted medical professionals, like doctors and nurses and pharmacists, have chosen to violate their oaths and put greed ahead of their patients. Amazingly, some have made their practices into multi-million-dollar criminal enterprises. They seem oblivious to the disastrous consequences of their greed. Their actions not only enrich themselves, often at the expense of the taxpayer, but also feed addictions and cause addictions to begin. The consequences are real. The emergency rooms, jail cells, futures lost, and graveyards are the results. And so today, the Department of Justice, in conjunction with the Department of Health and Human Services, is announcing the largest healthcare fraud takedown operation in American history. The Department of Justice coordinated efforts between our criminal divisions, U.S. attorneys' offices, Health and Human Services, and more than 1,000 state, local, and federal law enforcement agents to charge 412 defendants, including 56 doctors. These defendants have defrauded taxpayers of approximately $1.3 billion. As a result of this operation, 205 healthcare providers are now in the process of being suspended or banned from participation in any federal healthcare programs.